I'd like to welcome you to the Frozen Shoulder series. It has 9 parts, and the first part is the introduction. And we're going to be talking about why perhaps your partner or your mate should watch this presentation. And actually that's a really important part of this presentation because they just don't know what you're going through. And the second part of the introduction is, how do you actually know if you have a frozen shoulder? 7 years ago, I had a frozen shoulder. I know how much suffering it can cause you. When it first happened to me, I spent many hours trying to learn about frozen shoulder and many more hours trying to find effective treatments. I know what you're going through. I know the impact it can have on you and your relationships. So I made this series for you. It's my goal to help you find the information you want to know and need to know so you can make informed decisions regarding your care. But for now, just relax and listen to the presentation and then see what makes sense to you. So these are really common questions that anybody with a frozen shoulder or serious shoulder problem would ask themselves. How did this happen to me? Will it ever get better? When did all this start? Sometimes you can think of a time it did, and other times it just seems to come on out of nowhere. What can I do to stop the pain? What's going on in my shoulder? I mean, what's really happening there? How long will it last? Will I ever be able to move my arm like a normal person again? And one of the things that troubles many is my family's losing patience with me. What can I tell them? So these are normal questions that everybody with a frozen shoulder asks. In the beginning, the pain is always there. It drains your energy. It steals your emotional resources. You can't sleep. You can't concentrate. And sometimes you can't do your job. If your mate or someone you know has frozen shoulder, this may help them to understand what you're going through. To friends and family of frozen shoulder patients, it's important for you to know that they're suffering. They need your patience and they need your support. Now with proper treatment, this will pass and they will get better. To those of you who are in pain, who have frozen shoulder, it's just as important for you to understand that your friends and mates want to help you. They want to be there for you. They just feel helpless and frustrated that they don't know what to do. Frozen shoulder starts with sudden, sharp, annoying, but deep boring pain in the front of the shoulder, often for no apparent reason. The intensity may last anywhere from a few seconds to several minutes. But because of the nagging discomfort, we tend not to use the shoulder, which is just the opposite of the way you should treat a frozen shoulder. And we're going to talk about that. But in less than 1 week after this initial feeling, the arm movements are restricted, and the arm literally becomes frozen, where neither you nor anyone else can lift your arm above shoulder level in any direction. And because of that, the arm tends to hang stiff and immobile. Okay, how do you know you have a frozen shoulder? Well, several things just become really obvious. For women, they have to fasten their bras in the front and then spin the buckle to the back. Trying to get their arm behind their back is impossible, and just the mere effort of trying to do that will oftentimes start that terrible penetrating pain. So they may try a time or two, but they definitely give up on it very, very quickly. If someone bumps into your shoulder, or you bump into somebody else or something else, you can get that terrible pain that penetrates. It can last up to several minutes. Reaching into the back seat may set off that pain. Trying to put on your jacket, reaching for your wallet. All those can kick off that terrible, terrible pain, but one thing in common with frozen shoulder patients is that they cannot reach behind them. If you try to lift your arm, you'll find the maximum it's going to go is about 90 degrees up, parallel to the floor, and many people can't even get that far. Sleeping on your side is very painful. And in fact, whether you sleep on your side or not, waking frequently throughout the night is very, very common for frozen shoulder patients. And in fact, one of the criteria we use to determine what phase a frozen shoulder you're in, as how many times you wake up during the night, and how long you're able to sleep. Dr. Stetson is an MD. He's an orthopedic surgeon. And he says that 50% of patients go on to surgery if they're only treated with physical therapy. Well, we use physical therapy on our patients, but we also use a number of other techniques as well. And there's a reason why our results are so good. 90% experience very good to excellent results, and we're very proud of that. There is a better way, and we're going to tell you a great deal more about that in the next few parts.